Hello, it's Dr. Rhonda Johnson. Today's Thursday, August 13th, 2020. And today I'm going to be discussing heart disease and COVID-19 survivors, more news about children and this pandemic, and dire predictions about this fall from this director for the U.S. Center for Disease Control and Prevention. But first, let's talk about COVID-19 and heart disease. It's been known that the COVID-19 virus infects the heart and the blood vessels. In fact, the virus seems to replicate directly within the heart muscle. Now, numerous medical studies have found evidence of ongoing inflammation within the heart muscle, as well as the heart's lining, in a lot of patients who have recovered from COVID-19. But this week, there was an article published in the Journal of the American Medical Association Cardiology Journal that is worth noting. Now, admittingly, it's a small study, just 100 patients out of Germany, but more than 75% of these folks who had recovered from COVID-19 had evidence of serious heart disease on their MRI. Now, the researchers found that 75% of these patients had myocarditis and pericarditis, and both of those are two potentially very serious heart conditions. Now, myocarditis causes inflammation of the heart muscle, and it can reduce the ability to pump blood and cause irregular heartbeats and eventually some form of heart failure. And pericarditis is a true emergency because it causes inflammation of the protective tissue surrounding the heart. Now, what was so interesting is that these patients were young. They were between 45 and 53 years of age. So they had this MRI 2 to 3 months after being diagnosed with the virus and fully recovered. So why am I talking about this? Because there are a lot of people who have recovered from COVID-19. And if you're listening or if you know someone, please have them talk to their doctor about getting tested, getting evaluated to see if there's any heart damage from COVID-19. Okay, switching gears. Children now. The American Academy of Pediatrics and the Children's Hospital Association reported that there's been a 90% spike in the number of COVID-19 cases in children. But what is so tragic is they reported that the flu generally causes the deaths of 100 children each year in the United States. But already we've seen more than 90 children who have died in the last couple of months from COVID-19. So parents, please protect your children and know the signs and symptoms of COVID-19. I'll take a minute and I'll review. The 3 most common symptoms of COVID-19 in children appear to be cold symptoms like a runny nose, cough, and fever. Other symptoms are stomach ache, belly pain, vomiting and diarrhea, muscle pain and cramps, just not wanting to eat, headache. Their symptoms are very similar to adults. So if you think your child may have COVID-19, get them to the doctor. Please get them evaluated. Now, we know that there are over 5.3 million confirmed infections of COVID-19. And earlier this year, the CDC Director, Dr. Robert Redfield, said, take that number and multiply it anywhere between 6 to 20 times for the true infection rate. So, and we're close to 170,000 deaths that are officially reported, but the CDC director says we probably have surpassed more than 200,000 deaths due to underreporting. And the CDC director, Dr. Redfield, has some dire predictions about this fall, and he's urging everybody to get a flu shot. So please, I know a lot of folks don't believe in getting immunizations. And if you never got the flu shot before, this is probably the year to think about getting it and to discuss with your doctor and to take action even if you don't believe in the flu shot, because the combination of the flu plus COVID is going to be rough. Dr. Redfield said that this may be the worst fall from a public health perspective that the nation has ever seen. So just take that as a warning. He's asking everybody to do 4 simple things: wear a mask, maintain your social distance, wash your hands, and be smart about being in crowds. So that's the advice from the director of the Centers for Disease Control and Prevention. Okay, so that's my message today. As always, stay safe, stay the course, and have a blessed day. My views are my own, and I'm only trying to help us to stay alive.